and welcome to Your Health is Wealth. I'm your host, Dr. Loreena Ryder, alongside my co-host, Dr. Hannah Lindsay. On Your Health is Wealth, we provide practical tips on how to achieve better health. If you're struggling with your health, give us a call at Naturopathic Physicians Group.
Hi, everyone. This is Dr. Lindsay. I want to start out by chatting a bit about what is a naturopathic doctor. So a naturopathic doctor can provide primary care as well as specialized care. We look at the body as a whole and determine the root cause of your symptoms. And then once we know the root cause, we treat the cause rather than just your symptoms. So our initial appointment with you is about 1 hour. We really want to help you get better and stay better, improve your quality of life. And one of our foundational principles is that prevention is the best form of medicine. And that will segue us right into what we're talking about today.
Mm-hmm. Every week is a different topic. So today we're talking about preventative health. A couple of questions for you to ponder. Does your pet see the doctor more than you do? Has your car gotten more tune-ups than you do? We're going to be talking about preventative health today from a naturopathic perspective. We'll discuss basic standard of care recommendations, plus we'll give you our take on what we believe is important when it comes to living a healthy, long life. So what we'll cover, a few things, is just when to get your checkups, which type of checkups you should be getting. How often do you get blood work? That's a pretty popular question. So what we'll do is we'll just provide information from national health organizations on their recommendations for preventative procedures, and we'll also throw in some general daily habits that promote longevity.
I get this question a lot, especially with some of my younger patients, and just what I can do now to help me down the line. So that's really what we're talking about today. And we're going to start out by talking about why is this important? Why is preventative healthcare important? So, of course, your personal medical history, when you get regular checkups and regular labs completed, you're building your personal medical history for you to refer to. So your doctor can always look back at your records and see what's going on should you have a problem begin, or if you should develop a disease down the line. It's really helpful to have that past medical history to get to the root cause of what happened and where your health went wrong. Also, following medical trends. You should be getting regular lab work so we can watch what direction your labs are trending. So previous labs give valuable information into what your trends look like, and we can stop trends. If they're starting to turn and go into the wrong direction, we want to act now, and we don't want to wait until you develop disease.
Mm-hmm. I love those patients that ask what they can do now. That's the rubbing your hands together and be like, okay.
I'm like, this is my type of girl. Yeah. I'm like, yes, we're going to do everything.
Right, exactly. So what are some reasons why people don't make preventative health care a priority? There's several, and cost is a big one. Health insurance isn't something that everybody has or can afford. So just basically paying for your doctor's visit, paying for the labs, being healthy and preventative health, it costs money, and it's not something that everybody has the luxury to do. Another reason might be just simple unawareness. Many people are unaware of the timeline in which they should be getting preventative health care checks and procedures, and that's why we're doing this today. It's a nice little reference for you to look back on. Life's busy, time goes by. Before we know it, we're 40 years old or more, and we haven't seen a doctor in years. And so we want to get the word out so that you can live a happier, longer life and have the answers to when to get these checkups.
I think a lot of people think you only go to the doctor if something's wrong, if you're sick. But there is so much you can do to benefit your health before that. So like we said, prevention, it's so important. You don't want to get to the point when you're sick. So go see your doctor now. Mm-hmm. Another reason that someone might not prioritize preventative medicine is iatrophobia. And this is the fancy word for an extreme fear of doctors and medical tests. So seeing a doctor, getting a medical procedure, or even the thought or idea of it can cause panic attacks or even extreme anxiety. 1.3% of people experience this at one point in their lives. But if you suffer from iatrophobia, you might avoid seeing a doctor even if you're very sick or if you have some form of condition. So this is a reason some people might avoid going to the doctor. You can build it up in your head as something scary, and a lot of people are fearful if they get labs done, then they're going to find out something that they don't want to know. But trust us when we say it's better to know and get treatment than to not know and have it progress.
We'll talk about the people who only go when they're sick, and we'll talk about that being primarily a male thing. That's usually boys.
Sounds familiar.
So another reason why you might not go to the doctor is just plain old general anxiety about it. This differs from what Dr. Lindsay was talking about, the iatrophobia medical condition. This is general anxiety of doctor's offices, hospitals, medical procedures, needles, etc. All of these things they just come along with a doctor's visit. And white coat syndrome is a real thing. Even though we don't wear white coats.
That's why, we don't wear white coats. Don't worry.
But some people still have it. Their blood pressure is up, and they say it's just it just happens when I go to the doctor. So we deal with this regularly at Naturopathic Physicians Group, and it's understandable. Many patients have had bad experiences in their past, and it makes it hard for them to trust again. But I am happy to report that our office has a really great track record for putting our patients at ease and even healing those past emotional scars from previous bad medical experiences.
I think part of that is really the time that we get to spend with our patients. We're not trying to filter you in and out of our office in 5 to 10 minutes. And if you're in a form of healthcare where you can only see the doctor for a short period of time, you don't have a lot of time to really get to know them, cause that warmth. So we really like to get to know our patients and form that rapport and work with you to help you get healthy.
Yeah, we really do take the time. And we even listen to your previous bad experience. And we do our best to avoid those triggers that you have, whatever they may be. And we also do our best to make you feel comfortable during a medical procedure. We just got new chairs, and they're very comfortable.
They're very nice. I don't let myself sit down in them because then I won't get work done.
Yeah, they're really great. The IV chairs are electric. They're leather. They have a footrest. It's so nice. They even have LED lights. But yeah, so great. So we at NPG, at Naturopathic Physicians Group, I also like to really brag about the fact that we work as a team. Like, everyone in our office is extremely caring. And I'm including our front office staff for sure. If a patient is anxious or requires special accommodations, everyone is there willing to pitch in whatever's needed.
Yeah, we're biased, but we genuinely have the best staff ever. They're amazing.
Yeah, really.
And really a big reason why people avoid preventative health is that if they think if it ain't broke, don't fix it. They have this mentality that if they don't have anything going on in their health, they don't need to see a doctor. They're like, I'm fine, I'm healthier, even maybe I'm healthier than my friends and family. Like we said, this is really common in the male population to be like, I don't need a doctor, I feel fine. Whether it's male or female, it's just not a great mentality to have because like we said, we want to be establishing foundations to health now so that 10, 20, 30 years down the line, you'll feel better and not develop a disease.
So let's talk about some traditional diagnostic tests that you'll typically get whenever you go to an allopathic traditional medical doctor. They'll take a look at your physical body. So they'll do a physical exam yearly, and they'll include vitals, so taking your blood pressure, your temperature, your oxygen saturation, pulse, those kinds of things. And just general blood work is typically checking your red and white blood cells, your liver kidney function, and your lipids, which is your cholesterol. Now, this varies doctor to doctor. And this is what I see in clinical practice when patients bring me their previous labs. That's general. Normally, I'm disappointed with the lack of testing that's done in conventional care, but also I've heard from some patients that their conventional doctors are annoyed with our extensive testing, but that's okay.
Yeah, of course, something is better than nothing. I would prefer my patients come in with a few blood panels than to say they haven't had blood drawn in 10 years. Mm-hmm. But really, there's so much more that we can see in the blood if we just run a few more tests. So a few things that they might also do, it would be some visual scans for digestive health, depending on your age, what's going on in your life. You could have an endoscopy or a colonoscopy, also a sigmoidoscopy. They're just looking at different parts of your gastrointestinal tract. There's also a CT colonography as an option as well.
There's so many ways to look at the GI tract. That's probably not even like a fraction of it.
Right. Those are the basics that you might actually hear.
Mm-hmm. Yeah, there's also stool tests, which I think stool tests are really great. They can even be done at home if you have the proper kit, if the doctor supplies you with that. There's one called a fecal occult blood stool test that's pretty common. It just checks for hidden blood in the stool, so that could be a problem. If it's just hemorrhoid blood, then that's not an issue, but if it's coming from further up the GI tract, then definitely an issue. There's something called the fecal immunochemical test. This also checks for hidden blood from the lower intestines. The difference with this test is that there's no dietary restrictions needed prior to collecting your sample, so that just makes it a little easier for the patient. And there's also a DNA stool test, also checking for hidden blood, but this checks for cancer and polyps as well. So it's a little more comprehensive.
So again, depending on your age and your family history, medical history, a mammogram for breast health could be included in your checkup with a doctor. You may be getting x-rays for dental care. Don't forget about dental. It's just important to stay up to date with your dentist as it is your doctor. And a glaucoma test is often run at certain ages to check the health of your eyes.
Very important. So let's talk about some naturopathic testing. It's pretty much the basic is the same as the allopathic physical exam, including vitals. We want to check that. But then the specialized testing and the blood testing, there's honestly just too many to even list and tell you what they are. We obviously want to do general health blood labs plus many more extensive labs that dig deeper into each body system. We direct our testing according to patient symptoms and family history, and there's just so many different ways that you can test things. You can test blood, which is pretty simple. You can test spit. That's fun. No needles involved there. You can test stool. That's stinky, but a different experience. We can test urine. There's just so many. Hair, we don't do breath, yeah. All kinds of bodily fluids.
Really anything that comes out of your body can probably be tested.
Right.
Yeah, so and there's the different ways to test is going to be based on what labs we're looking at or what we're really trying to discover with your lab work. But we do a lot of specialty testing at Naturopathic Physicians Group, as well as our general basic annual blood lab panel. Like Dr. Ryder mentioned, it's just a lot more extensive. Of course, we're going to always follow the standard of care when it comes to preventative imaging and procedure recommendations. So this would be including like mammogram, colonoscopy, which we will discuss a little later in the show, the specifics of at what age and what timeline do you need to be getting mammograms and colonoscopies.
There's also something that some people prefer instead of a mammogram. It's called thermographic imaging. Now, this is not FDA approved as a standalone substitute for a mammography, but I think it is good to have those, even if you want to do those in between your mammograms, kind of space those out a little bit. But it's pretty popular, and it seems to have been gaining steam over the last few years, maybe even a decade or more. So I think it's worth mentioning.
It's a little more pleasant to endure than a mammogram as well.
Right.
So keep that in mind. Like Dr. Ryder mentioned, stool testing. Of course, the stool testing that we are going to do at Naturopathic Physicians Group is typically a lot more extensive than you're going to find. The standard stool testing that your allopathic doctor is going to do is really going to be looking for signs of blood or cancer, small markers. We can do comprehensive stool testing where we are looking at your entire microbiome and the makeup of it. We can look for candida overgrowth. We can look for parasites. We can really anything that could be going on in your stool and your GI tract we can see. So stool testing is a really cool option, especially if you have something going on in your gastrointestinal tract.
Yeah, I'm actually amazed at how comprehensive the stool testing is for us. Some of the things on there, I'm like, whoa, I didn't know that actually could be tested in the stool.
I was actually just looking at one of the sample reports today, and I'm like, some of this information I wouldn't even know what to do with.
Yeah.
It's so extensive.
Yeah.
So.
Yeah. And hormones, we can test those a number of ways. Blood, urine, and even the saliva as well. So that's pretty cool. And also, I love to check mold and mycotoxins in people. This is a bigger deal than most people think. You can have mold hiding in places you never even suspected. You can't even see where some of the mold is hiding. And then whenever you're in that environment, then you start breathing it in unknowingly, and then it starts to settle in your body. And then you get all of these health problems that aren't explainable and typically aren't found at your conventional doctor's office.
And mold toxicity, if you have mold in your body, it can present just about any way thinkable. And a lot of people, some people will come in for preventative health and they might think that they're healthy, but you don't even realize how good you could feel if you haven't been taking care of yourself or you're not eating right or potentially have an underlying mold or your microbiome's off, any of these things, you could be thinking that you're healthy, but you're not actually living your optimal health or feeling as good as you could. So another test that we run is toxic heavy metal testing. So a lot of people, especially older individuals, have been exposed to toxic metals in their lifetime, and these can build up in our tissues. And so these can present with a multitude of symptoms as well. But again, you want to prevent these things or catch them before they start presenting as symptoms.
Mm-hmm. You said older individuals, not that old, just so everybody knows. I think they stopped doing lead paint in the 70s or 80s, something like that.
Mm-hmm. Lead paint, lead and gasoline, even fillings, depending on what type of filling you've had in dental work, you can be exposed to toxic metals a lot of different ways.
Yes, definitely. Also, we do micronutrient panels as naturopathic doctors, and these are super cool. So these check your vitamin levels. So your D, your Bs, Cs, any type of micronutrient you have, your minerals, your good metals, that you need good metals in your body as well. So it tests those. It will test your omegas. If you're over in some or under in some, which would be more likely, it's good to know that so that you can start early and supplement those or increase the foods that have those nutrients in them. Just that way your body is just well-rounded and balanced when it comes to nutrients.
We talk about this a lot, but food allergy or sensitivity testing, this is huge. There are a lot of different opinions out there on nutrition and diet and foods that are inflammatory. And of course, there's your hard hitters, gluten, dairy, sugar, that kind of everyone likes to point our fingers at as being inflammatory for good reason. However, if we are able to run a food sensitivity panel, then we can truly see what foods are specifically inflammatory in your body. So this is the best way for us to individualize treatment when it comes to improving your diet. And cutting out your food sensitivities, you name it, anything can improve. Having this increased inflammation in your body contributes to a multitude of symptoms. So you start eating cleaner and cutting out inflammatory foods, you're going to sleep better, you're going to live better, you're going to feel better, pounds are going to drop off. It's such an important test.
It's a game changer for sure. And you can do this more than once. Once a year would be like a good time to do a food panel, I think, because they can change. The allergies, true allergies that you were born with likely don't change, but the sensitivities that you develop over time, they can come and go. So that's why it's good to do it annually. We also like to do cortisol testing. Cortisol is super important for energy, and I have so many patients that just come in due to fatigue and lack of energy. And cortisol can be tested in a multitude of ways. It can be tested in urine, it can be tested in saliva, it can be blood tested. There's so many avenues that cortisol goes through and steals from other nutrients in the body. So that's an important thing to do.
We've also recently discovered some specialty labs to actually check CTCs or circulating tumor cells as a routine annual preventative marker. So this is really prevention focused on preventing cancer and it's specifically catching cancer very early on. So if you have a high risk of cancer or a strong family history, this could be something to consider.
Exactly. Since it's just us girls here today, I feel like we can pick on the boys a little bit more, but I have a fun fact. So since boys don't like to go to the doctor, studies show that married men live longer than unmarried men. The wife is typically the one that drags their husband into the doctor.
That checks out.
Yeah.
Today we are talking about preventative health.
Dr. Ryder here with your tip of the week. This week I would like to talk about self-respect. Give yourself a little R-E-S-P-E-C-T. Do you remember that song?
Find out what it means to me.
There you go.
Of course.
Good. You're not that young.
Oh my goodness.
So caring for your mind and body is a sign of self-respect. I recently read this article where scientists were studying the public's internal monologues. So that little voice inside your head. This article was so interesting. I had to read it like 3 times. But it turns out not everyone has an inner monologue. I was blown away. Some people have an inner voice that's very clear, complete with sentences and tone and inflection. And others experience imaging. and sensory awareness or a consciousness about their own emotions. And some people, I feel like I know a lot of these people, some people just go through the motions of daily life without any inner monologue at all. They're like the doo-doo, just...
Probably also usually men.
Yes! Thank you. I didn't say it that time. But all of these things that I just mentioned, they can happen at different times of the day and in various percentages of people. However, regardless of your method of internal voice, be kind to yourself. Speak positively to yourself in whatever internal language you use. Pay attention to those negative thoughts that creep in and speak back to them. Take up for yourself. Intervene that negativity just like you would if someone was speaking badly to a good friend of yours.
This is like that research where you talk really good to one plant and really bad to another. Have you seen this, where the plant you talk bad to dies? Even with water, if you take a glass of water and talk really good to it versus really bad, it changes the crystalline structure of the water.
Yes, that's what I know. That's amazing. They actually have books of pictures of that where it shows the good water, the water that was speaking good to,
right,
and the water that was speaking harshly to. They've also done it with different types of music, like classical music
versus rock or
heavy
screamo.
Metal. Yeah, screamo.
It really is crazy. And when you think about it, how much of our body is water? So the way you speak to yourself can actually change the structure of the water.
I love it.
Something to think of. So now we're going to jump into those testing recommendations. So like we said, when should I be getting these tests done? On what timeline? How often? That's everything we're talking about now. So to start, blood labs, just your annual blood labs. Ideally, you're going to be doing it once a year, but once per decade is the minimum. So, once in your 20s, once in your 30s, once in your 40s. Once you reach adulthood, though, yearly annual blood labs are recommended. And that's truly so that we can watch those trends, like we talked about earlier. If you're skipping your annual blood work, it makes it really difficult to follow those trends and prevent disease before it presents.
Now, even if you can get like a child in before they're 10, that would even count as their first decade, right? Mm-hmm. So that would be just a good start. And then if you would get blood work in for kids twice before they turn in adulthood, that's pretty good. Now, I understand if someone has chronic disease, so on and so forth, they're used to getting blood. But most of the time, kids are not used to coming in and just giving blood like adults do. Mm-hmm. Yeah. Routine checkups, let's talk a little bit about those. And we mentioned dental and eye exams earlier in the show. So dental exams you should actually do annually with x-rays at least once a year to catch any decay in its early stages. And every 6 months you should get a cleaning to minimize the occurrence of periodontal gum disease. Teeth is something that you can forget about just like the rest of your physical body, but it is super important because a tooth decay can turn into an abscess. It can turn into something very serious if you just let it go.
Yeah, even my dentist, I go in every 6 months for my cleaning. That's not something I did for most of my life, but I finally reached the age where I'm consistent with it. And he does a quick oral cancer screening with a UV light. And even something like that, being able to catch something very early on, getting that checked every 6 months or annually, it can make a really big difference. So we talked a little bit about eyes as well, the health of your eyes. So an eye exam annually is really important as well. This can be to screen for vision problems, glaucoma, cataracts. You can see some signs of diabetes in your eyes. You can also look at your retinal health and even some cancers.
Yeah, very important. Let's talk about mammograms. So a lot of women, they come in and they ask, when do I get my first one? How often do I have to come back? These are the questions that we're going to answer. So mammograms are recommended starting at the age of 40, but you have the choice. So if you're a 40-year-old female, you can decide if you want to start screening mammograms. Now, the United States Preventative Services Task Force says that you should start them at age 50. So from 40 to 50, it's your choice if you want to do it. At 50 years old, you should definitely be getting a mammogram, and you should get one every 2 years so long as they're clean. So that's up until the age of 74. So from 50 to 74, mammogram every 2 years. Once you reach the age of 75 and above, it's a risk versus benefit type thing then. If you're low risk and you don't really enjoy mammograms, I don't know who does, but you don't have to get one. But there's no evidence telling us whether it's good to get it or it's okay not to get it. So it's that between 40 and 50 years old, it's up to you and your doctor.
And of course, these are just the general recommendations. It really is so important to speak with your doctor about your specific care and timeline. That age 40 to 50, when it's up to you, it also is going to depend a lot on your family history and your risk factors. And there's certain genetic markers that can put you at higher risk for breast cancer. If you have a close family member who developed breast cancer in their 40s or at a younger age, it might make more sense for you to start those mammograms earlier. So it's really important, no matter what we say about these timelines, to just make sure you're getting the care that is individual to you. So another fun procedure that everyone loves is a colonoscopy. Yay. So when do we have to start these? Regular screening of colonoscopies should begin at age 45. Around age 50, this is where they say at least one screening every 10 years should occur after the age of 50. So that would be one screening in your 50s, one screening in your 60s, etc. From age 76 to 84, you'll see the cutoff for both of these are around 75, 76. 76 to 84, the decision to continue screening is going to be based on your family history, your prior screening history. So if you had a screening that was abnormal or something came back, it's going to depend on your life expectancy, of course, patient preference we always consider, as well as your overall health. So your doctor may recommend that you no longer receive colonoscopies due to that kind of benefit versus risk factor that we were talking about. And then after age 85, it's recommended that you no longer get colorectal cancer screening. Of course, we talk about this a lot when we're learning about these screenings. They say no longer getting screening after age 85 because they consider if there should be cancer that develops, the life expectancy of that. However, if you're 85 and you have 20 good years still in you, then that's going to be a very different case. So again, individualized treatment is so important.
So far, the over the hill at age 40 sounds to be the case. Start screening at 40, 45.
Around the age when you should start checking your appointments.
Yeah. So the female gynecological exam, let's talk about that a little bit. If you're over 21, you should have an annual well woman's exam, including the pelvic exam and the breast exam. However, if you have not yet been sexually active, a female exam may not need to be done. That's only if you're having a problem. And then with pap smears, there's different recommendations and regulations for those as well. We'll get into those here in a bit. But basically, you need to take a look at every aspect of your body from head to bottom and get it checked and tested regularly in order to avoid any hazardous happenings down the road. Catch it early.
Right. The reason these screenings are all planned out at these timelines for a reason. It's because these are the ages where these things, potential risks and diseases can start to present. So like we said, we want to catch it early. You don't want to be getting a colonoscopy after an issue or a mammogram after an issue. You really want to be preventative.
Today we're talking about preventative health care.
So let's talk about the pap smear, another test that everybody loves, right? So we mentioned that the female gynecological exam should happen annually, and this is just going to be a general breast exam, potentially a pelvic exam, depending on what's going on. A pap smear actually doesn't need to occur annually. And these guidelines, the American Cancer Society guidelines, actually changed in 2020. And I know a lot of people were distracted by other things going on in 2020, so it wasn't really talked about that much. But now the current guidelines state that starting at age 25, you only need a primary HPV test every 5 years. This is the preferred method. So this means every 5 years you get an HPV testing and then you're good. So if you don't have primary HPV testing available or if it's limited, you can do co-testing every 5 years. So this would include a pap smear, also called cytology, as well as an HPV test every 5 years. Or you could do the cytology alone, the pap smear alone, every 3 years. So this is what I've noticed a lot of people are used to, is doing the pap smear every couple years, every 2 to 3 years. But now it's changed to every 5, which is nice.
I think it's noteworthy to say that, because a lot of people, even further back, were used to yearly. I got to go get my yearly exam. But that changed, and they expanded that or pushed it for every couple of years. But now, as long as everything's fine, it's every 5 years. So it seems like a long time, but honestly, if they've not found a reason to make it every year, every 2 to 3 years, which I agree with this, unless you have an issue, hey, it's every 5 years.
Right. And of course, this changes if you have an abnormal PAP. You're going to have to go in more often for follow-ups, but this is just the general guidelines, nothing wrong, nothing's going on, all that stuff. And so that's going to be from age 25 to 65. And then above age 65, they recommend that you discontinue screening as long as you've had adequate negative prior screening, which that's going to be defined as 2 consecutive negative primary HPV tests, or 2 negative co-tests with HPV and this cytology, or 3 of the negative cytology tests, all within the past 10 years. So one of those 3 within the past 10 years, with the most recent test occurring within the past 3 to 5 years.
And when you say cytology, you're talking about the PAP.
The PAP smear, yes. So that's something to consider after age 65. You can discontinue the screening. However, same thing with the colonoscopy. If still have many years ahead of you, if you are having new sexual partners after the age of 65, then the guidelines are going to look different for you. It would be important to consider screening, to continue screening if you're having new sexual partners and being exposed to new partners.
Yeah, and something also to make note of for the pap smear, and if you have never been sexually active, you really only need a pap smear if you're having a problem. Pap smears screen for cervical cancer risk, and your risk of cervical cancer is very low if you've not been sexually active, like ever. That's not talking about right now, it's talking about ever in your life. Typically, cervical cancer is caused by an HPV infection, and so you would have no risk of HPV because it's a sexually transmitted disease. Let's talk about some naturopathic treatment options. I think we've supplied you with the general when to get your checkups, which ones are most important, ages and all of that. That's really great information to have. So let's talk about some things that you can do in your daily life to just help longevity, help you live longer, help your immune system, and just generally live a higher quality of life. So we talk about diet every week, and this week is no exception. We talked about the food panel earlier, and if you get that food panel test done, we suggest you follow the recommendations that are on it. Don't just say, yeah, I've got that done. And then it's so funny. I'll go back maybe 6 months later if I'm seeing a patient and say, hey, let's review your food panel. And they forget what's on there. And they've been eating those foods. They follow it for maybe 3 months, and then they just fall to the wayside.
Right. All this testing is great, but what's the point of it if you're not going to follow it? So that's a really great way to improve your diet. We're going to talk about a few general daily supplements that typically have a benefit to everyone. As always, as we're talking about supplements and treatment options, it's so important to consult your doctor. Everyone is individual, so don't start taking anything or stop taking anything without consulting your doctor first. But vitamin C is one that a lot of people are familiar with and a lot of people take over the counter. Vitamin C has a lot of antioxidant properties. A lot of people know it is very supportive of your immune health. Vitamin C is actually part of collagen, so it's going to help with your bones, your teeth, your cartilage, so it can help with joint pain, helping build that collagen. It's going to help to grow, develop, and repair all of your body tissues. It also helps to absorb iron into your body, so this can help to protect you from iron deficiency or anemia. Also, fun fact, smokers need at least 35% more vitamin C than a non-smoker. And this is due to the oxidation process that happens within the body from smoking. So if you're smoking, of course, we're going to say to stop smoking. But keep in mind, you would need 35% more vitamin C.
Mm-hmm. I think vitamin C got a spotlight whenever COVID came around. Everybody was taking vitamin C, and that's great.
There's a national shortage.
Right, there was, yeah. Vitamin D is another really great supplement that everyone can benefit from. It's really helpful in immune health, also bone building and skin health. And it can assist in the prevention and decrease in symptoms of multiple sclerosis. There's just way too many things to list here for vitamin D, but those are some big ones.
Yeah, vitamin D acts as a hormone and a vitamin in your body. So it's crucial for really any autoimmune condition out there. And if you're not getting vitamin D tested, that's one of those tests that we typically run annually.
Yes.
Fish oil is one of our other favorites. So fish oil is really great at reducing triglycerides, and this is a harmful lipid that can ultimately lead to a potential stroke. Fish oil is also very anti-inflammatory, so it's really great for reducing pain.
Mm-hmm. The only time fish oil would be a bad thing is if you're preparing for a surgery, and then you would be asked to stop taking that a couple of weeks prior to, just because it's a blood thinner, which can be a good thing, but not whenever you're having a surgery.
Yeah.
Probiotics are something that everybody can benefit from typically, and some conditions that are improved by supplementing with probiotics are diarrhea and or constipation, those IBS, the irritable bowel syndrome symptoms. It's also really great for immune health, helps out with that. Urinary tract infections. A lot of people don't know this, but the tissue that's inside the GI tract is the same type of tissue that's inside your bladder. So if you're helping your gut get healthier, you're also helping your bladder and your urinary tract get healthy. Probiotics are also really great for yeast infections and eczema, skin condition.
Yeah, 80% of our immune system is in our gut. So if you're looking at improving your overall health, your gut is a great place to start. B vitamins, our bodies use B vitamins as cofactors in almost every chemical reaction that happens in our body every single day. So if you are depleted in your B vitamins, can be a significant problem and can lead to disease in the body. So B vitamins are good for immune health, for energy, brain and nerve function. They can be anti-anxiety, they can support hormone health, cardiovascular health, help to prevent anemia, and even support healthy pregnancies.
Zinc is another great supplement that helps support your immune system. It also helps with wound healing, diarrhea. It can slow the progression of macular degeneration, and it's also helpful in your sense of taste and smell.
Magnesium is one of our other favorites. Really, every supplement that we're talking about is a favorite. But magnesium is really great for heart health, muscle and nerve function, bone health, energy, bowel regularity. It even can help to normalize your blood pressure. So magnesium is a great one to keep in mind.
You talked earlier about smoking, so just a couple little facts about smoking. Life expectancy for smokers is at least 10 years shorter than non-smokers. So if you quit smoking by the age of 40, this reduces your risk of dying of a smoking-related disease by about 90%.
So last thing we'll mention is reducing or avoiding alcohol. Keep in mind that heavy alcohol consumption is significantly linked to a shorter lifespan. So just keep in mind, moderate drinking can be okay, but heavy drinking really hits your health hard.
Thanks for tuning in. We'll see you again for another episode of Your Health is Wealth.